So as a general cardiologist, I'm responsible for evaluating and treating patients with heart disease or patients who may be at risk for developing heart disease. And so I see patients in the office setting and in the hospital, and I also perform and interpret a lot of the cardiac diagnostic testing and imaging studies that our patients are going for. Yeah, so I went into cardiology because I felt it was a very dynamic area of medicine. Things are changing all the time, and it's a challenge to keep up. But to follow patients to build a relationship with patients and to follow them over the many years is very rewarding. So as far as that first patient visit with me, or in fact any visit really, if it's a follow-up visit or if it's a new visit, it's always helpful to have the information that we need. So especially if it's a new patient, if they've maybe had some testing already done or were in the hospital ahead of time before that, I guess we'd want to know about that so that we can either they can bring the records with them, or if they at least tell us ahead of time what testing they've had, or maybe they're out of state, or maybe they saw a different provider and maybe we're a second opinion, but at least if we knew what information there was, then we could either help to request it so that we have the information that we need, so that we can make the visit as productive as possible. Always good to have, if they're on prescription medications, the patient should bring an accurate list with them, or if not, even the bottles of the medicines that they're taking, just so that we can be absolutely sure that, that what we think they're taking, they're actually taking. So that's important. So these are some things that they could do ahead of time to make sure that the visit is productive. I'm a local guy who was born and raised here, went to school. The majority of my training is here. Whereas a lot of people left Buffalo for other opportunities. I was happy to come back. So, I love living in this community, and I love caring for patients, and I try to do the best job I can. So on a personal level, when my wife delivered our two daughters, we went to Millard Suburban. When I broke my ankle and needed it to be fixed, I went to Kaleida. When my dad was sick last year and needed surgery, abdominal surgery, we went to Kaleida. So I do believe that the quality of the care in the system is excellent, and so that's a large reason why I joined the team.